Hello guys, my name is Dominique Lloyd. I am with the Minority Psychological Network, and sorry for being a little late, but I am giving a webinar on substance abuse. Why are we in this pandemic? As we can see, rates of alcohol assumptions are on a rise, and just oftentimes, sometimes while you're bored, you might want to cope with, using more alcohol or smoking marijuana. But I just want to make sure that you guys understand the limits of what's appropriate, and then when your usage can go to a problem of addiction or just needing more help. So we're just giving this webinar just to inform people on substance abuse. So I will be talking about the different classes of substance abuse, what long-term use of substance abuse can do, influence on using substance abuse, and finally just seeking help. So the definition, a pattern of substance abuse leading to clinical significant impairment of distress, manifested by one or more of the following occurring within a 12-month period. So this means if it's impairing your judgment to obligate, your role of employment, school, or even being at home and having to do with your home life, it can result in poor performance at school or at work, repeated absences, and suspensions from school or neglect in your household. So the use in situations in which it can physically be hazardous. So if you're driving an automobile or operating a machine while you're at work, obviously using a substance is not the key thing to do. So, and then of using substance abuse despite having persistent or recurrent social and personal problems, cause effects. So if you're having arguments because of your intoxication, or just using it as a way to cope for different problems, that can obviously spark different things. So let's continue with the different classes. So with statistics, it is shown that 19.7 million American adults aged 12 and older battled a substance use disorder in 2017. Almost 74% of adults suffering from substance abuse disorder struggle with alcohol use disorder. About 38% of adults in 2017 battled an illicit drug use disorder, and I'll continue later to classify what illicit drugs are. That same year, 1 out of every 8 adults struggle with both alcohol and drug use disorders simultaneously. So that's very common when an individual is battling a substance abuse. They might use other substances to cope while they don't have their preferred drug. In 2017, 8.5 million American adults suffered from both a mental health disorder and a substance abuse disorder. So they're using either both to cope with one another, or somehow they develop a mental health disorder while using the substances. So substances and the effects on their brain. So addictive drugs floods the brain center with the neurotransmitter dopamine in amounts that are 2 to 10 times greater than those released during pleasurable activities. So this is basically saying if you find pleasure from ATV riding or skydiving, doing something elaborate like that, using addictive drugs, it gives you extreme more power, and that's what gives that more addiction to it, because you want that power more, you want that feeling, that rush immediately. So brain chemistry changes, and more of the drug is needed to reduce the same euphoric experience. So of course, Once you try a little amount and your body gets used to it or likes that rush, your body is basically chasing after that same rush, and eventually you're going to have to continue to use more and more and more. When taking the drug, users commonly experience depression that leads to compulsive drug use. So being addicted to drugs, you might lose very significant things in your life, which makes you depressed, and that causes you just to continue to use because this is all you know, and that might be a comfort to you. Long-term substance abuse affects brain function, memory loss, learning difficulties, and impaired judgment. So marijuana causes short-term memory use. Alcohol shrinks the brain over time and increases the risk for dementia. Inhalants damage brain cells faster than any other substances. So, effects of substance abuse on the respiratory systems. So, substances can cause coughing, chronic bronchitis, and worsen asthma. Heroin and narcotic painkillers and sedatives disrupt the drive to breathe and may cause respiratory arrest. The use of inhalants can cause concentration of inhaled fumes replacing the oxygen in the lungs. Obviously, over time, it becomes more harder to breathe and have just a flow of breathing. So, different drugs like heroin prescription drugs can slow or disrupt the heart rate to the point of death because heroin and other prescription drugs can make you, because if it's the heroin inside, it can make you just so relaxed sometimes and slow down your heart rate that it will cause you to die. Cocaine, meth, ecstasy can cause life-threatening effects, including irregular heartbeat, increased blood pressure, stroke, and cardiac arrest. And feel free to leave any questions or comments. So there are 5 schedules of drugs and then of alcohol. So categories of all substances which are regulated under the federal law into schedules depending on how potentially dangerous they are. So it goes from 1 to 5, and then we have alcohol. So Schedule 1 substance includes heroin, LSD, marijuana, and GBH. So these are very high potential of abuse. They currently have no federal accepted medical use and treatment in the United States, but recently, now we're able to use marijuana more for, I guess, medical purposes. There's a lack of accepted safety for use of the drug and other substance under medical supervision. So Schedule 2 includes like morphine, cocaine, methadone, and methamphetamines. These are also a high potential for abuse, but oftentimes like morphine, there's different categories where they would use that in medical use only if it's served with very high restrictions and only in those medical provisions. So abuse of Schedule 2 drugs may lead to severe psychological or physical dependence. So as we know, morphine, it can make people very addicted, especially if they experience it in the hospital, oftentimes by, getting some type of injury and they needed it. Cocaine and methadone, you usually see that more if recreational use, but again, it can definitely be very high potential for abuse. So Schedule 3 drugs include like steroids, codeine, hydrocodone with aspirin or Tylenol, and these substances are less potential for abuse than the drugs of substances in Schedules 1 and 2, but they still have a high potential for abuse. And when they're unable to get those type of drugs, they will move on to either Schedule 2 drugs, which is like heroin, because of the availability of it. They have a current accepted and medical use and treatment in the United States, and they may lead to moderate and low physical dependence, and then a high psychological dependence. Schedule 4 drugs are like anti-anxiety and those type of drugs. So like Klonopins, Valpex. These are other substances that have low potentials for abuse, but then again, commonly when you see people using a lot of substances at once, they might use these pills to because they're more available, because people are getting them prescription, so they might use those in different things in those aspects, and then on top of using like heroin and meth and those type of things. These are currently accepted in medical use. As I said, some of those drugs that I listed, prescription drugs, are used for anti-anxiety, PTSD. So a lot of individuals might get those prescribed, but a lot of the medical providers do not know they're abusing those drugs. So abuse of the drug or other substance may lead to limited physical dependence or psychological dependence related to the drugs or other substances in Schedule 3. So Schedule 5 include cough medicines like codeine, and these are low potential for abuse. They're currently accepted in medical use and treatment, and they're limited to physical dependency. So alcohol, obviously that is accepted in our society if you are 21 and older, and alcohol affects everyone differently. Everyone has different control rates, whether there's drinking too much or too often, or either drinking too little can have an effect on different people's bodies. So heavy drinking can cause liver and other health problems. For men, drinking more than about 4 drinks a day or more than 14 in a week is too much. For women, heavy drinking is considered more than 3 drinks in one day or more than 7 drinks in a week. So influences on drug use. So right now we're going through a pandemic. People are obviously have more time on their hands. There's limited things to do, limited things to go. The grocery stores is open, the liquor store is open. So these can be potential influences on drug use. I mean, you have liquor stores that are open, as I mentioned. They continue to allow dispensaries to be open. So sometimes our environment can push people to use more substance than we would like. Rather, it shows to be cool in the streets. It shows to be cool on social media. We see that in music. We see that on the movies. So that can be one thing. As I mentioned with the COVID right now, it can be self-medicating. Some people don't know how to deal with just being at home in this environment right now with literally nothing to do. People are going through economic crisis. So sometimes people might use substance, alcohol, or other illicit drugs to basically self-medicate through these issues that they have in hand, especially when you have to feed your family or help out in other ways. You don't know how that's going to occur. We might have loved ones that are passing around, that's dying around us because of the virus. So people might use substances to self-medicate. They could also be using it to avoid their feelings, not wanting to talk about it. Everyone is kind of in the same boat, which is kind of hard when you can't really use that much resources like actually going to see a mental health provider unless you call one of the 1-800 mental health numbers that they provided. So seeking help can be a very difficult thing. Avoidance can be very serious right now, so it can dampen the mood response associated with stress, so the sadness, frustration, anxiety. And so if you're also exposed to substance at a young age, it increases the likelihood of using substance. So either family who uses drugs or friends who uses drug is one of the influences on drug use. So individuals who suffer from PTSD are between 2 and 4 times more likely to also battle with addiction. And substance abuse helps an individual to avoid painful memories associated with this trauma. Withdrawal from drugs can cause symptoms of PTSD to worsen. Substance abuse may contribute to the onset of PTSD, as just PTSD symptoms can induce a person to abuse drugs or alcohol for self-medication purposes. So as I mentioned, if they're unable to get those class 5 drugs like the Klonopins and things like that, that helps with PTSD, they might use drugs to self-medicate. Or even if they're still in the environment where they received all this trauma, and they might have experienced trauma in their earlier days, and now that they're older, they've turned to drugs to self-medicate and avoid those feelings and avoid those mood responses. Drugs might be a common thing to use. And as I previously mentioned, if you have friends who do it, family members who do it, they can influence you as well to use. So drug withdrawal symptoms can increase PTSD symptoms, worsen the disorder, and making it more difficult to stop using drugs. So how alcohol withdrawal timeline, it can last for 6 to 12 hours post ingestions. So you might have anxiety, headaches, shaking, nausea, and vomiting. 12 to 14 hours, you can be disoriented, hand tremors, or seizures. 48 hours or more, you may have seizures, insomnia, high blood pressure, auditory and visual hallucination, high fever, and excessive sweating. And for alcohol withdrawal, acute alcohol withdrawal, it occurs after the first few days or weeks after one stopped drinking. During this time, one is more at risk for experiencing temporary loss of consciousness and seizures. It's never recommended that someone attempts to undergo with alcohol withdrawal alone, so you should definitely seek help. I will go later on about different places where you're allowed to seek help that's, help you with medical treatment as well. So post-acute withdrawal syndrome, prolonged symptoms after the initial withdrawal symptoms, which can last about a week to a year. Common symptoms include emotional outbursts, trouble sleeping, memory issues, dizziness, chronic nausea, delayed reflex, anxiety, low energy, and intense cravings. So heroin withdrawal, these symptoms can last a week or more and can be very serious. So these symptoms are the following: nausea, abdominal pain, sweating, shaking, nervousness, agitation, depression, muscle spasms, and then cravings for more drugs. So the decrease of severity for moderate and severe, moderate would be like vomiting, diarrhea, restlessness, tremors, troubles concentrating, fatigue. For severe, it would be like anxiety, insomnia, depression, rapid heart rate, muscle spasms, difficult feeling pleasure. Heroin withdrawal timeline, it begins to 6 to 12 hours post-ingestion, peaks after 1 to 3 days, subsides after a week. Withdrawal symptoms are regulated by the length of time one has taken the drug and the amount of drugs taken. Usually with individuals who use heroin, depending on how they administrate, so if they administrate by IV, they usually will take in a lot more, and they don't understand what the drug is cut from whoever they bought. So the length of time the drug it takes to digest might even take longer, or before the high is even coming down, they're immediately taking either opiates, benzos, more heroin to make sure they don't have any of those withdrawal symptoms. So cocaine withdrawal, it's difficult concentrating, slowed thinking, slowed activity or physical fatigue after activity, exhaustion, restlessness, inability to experience sexual arousal, and then physical symptoms such as chills, tremors, muscle aches, and nerve pain. So these symptoms may subside after 7 to 10 days. However, cravings can be persistent and can suddenly appear after years of non-use. So these cravings can usually happen. I've heard a lot of individuals, being a substance abuse counselor, smells, like particular smells, will bring them back to when they used to cook different drugs. Obviously, stress and different triggers, whether it's a situation that reminded them of when they wanted to use or why they would use to subside those that feeling. People, the environment is really big. See that a lot with my clients. They want to stop using, but people they know will just at this point give them free drugs. So the length of time can be shorter use for cocaine and less severe the symptoms, but more use and increase the severity of symptoms. So it increased the severity of withdrawal symptoms the more you do use. And then, like I said, environmental factors with cocaine and crack is large. It can definitely be an answer to stressful situations, and stress can become a big trigger. So with methamphetamine, these symptoms may include hopelessness, sadness, depression, muscle weakness, decreased appetite, lack of motivation, anxiety, insomnia despite exhaustion, headache from dehydration, muscle pain, especially in the jaw from clenching, and fatigue. So people tend to take more once the come down begins for several reasons. As I mentioned before, to escape the come downs, to escape the depressive episodes, to feel that euphoric feeling that they had, and avoid physical weakness. So tweaking occurs when the individual takes increased amounts of methamphetamines in order to postpone the symptoms associated with come downs. So the important thing is seeking help. After I gave a lot of information today, you might feel like you might need the help, or you know someone who needs the help. And after I explain those symptoms, you might see like this is a very serious thing where you want to get the addiction cut down as much as possible and get them help right now. And all these programs that I'm mentioning are still open during the pandemic. The best thing I would do was to Google which one is closest to your area and the hours they are doing intakes. So with methadone clinics, they help usually with benzos and heroin, and cocaine. So these are Suboxone is usually used with benzos and opiate users, and it helps them block out the feeling of euphoric that they get when they take the drugs. And then there's a methadone clinic called BART and Aegis. These are located around Los Angeles County and the outer parts of Los Angeles that are still taking people if you need the help. There's also inpatient treatment centers that are still open, like Tarzana, Another Chance Health Services, and PH Drug Addiction and Treatment Center. There are also outpatient treatment centers. The Los Angeles Department of Mental Health is a very good program to utilize, and they have the 1-800 number that they're providing. I can leave it in the comments later, but it's you can speak to a mental health provider that it's a professional license, and they can give you more information on how to seek that, as well as the Los Angeles Centers for Alcohol and Drug Abuse. You can also try Psychology Today, which is kind of hard during the pandemic, but if you still know somebody during the pandemic that is having issues, afterwards you can utilize Psychology Today, and they will have different services that's closer to your neighborhood, and you can pick and choose what provider will work best for you. There's support groups that's going on right now. There's actually doing Zoom NA meetings and AA meetings completely free during the pandemic, since we are practicing social distance. So this is very good to use right now if you feel like, okay, I might be having an issue right now, or I do technically have a problem after hearing all the situations and the symptoms that I've listed, so let me try to seek help, and you can get help during that. There are needle exchange programs. Those you have to look at that's closer to your area. And there's also housing programs and shelters that's still open and still taking intakes right now. Beacon of Hope Transitional Housing and Salvation Army Housing. So if you guys have any questions, please feel free to leave it in our comments, and I will be more than welcome to provide more information on substances. The most important thing is finding healthy coping skills during this time. As I mentioned, we are all going through this together, but there are people, clinicians that are willing to help and want to be there for you. We can find you projects. If we talk about it, find you projects. You can exercise more, you can read more, you can do things at home that's get that same pleasurable feeling instead of using substances and alcohol to fulfill your time. Thank you.